Hey guys, this is Caesar with Nursing School Made Easy. I know a lot of you are about to graduate, whether you're PN, RN. This topic for today is going to be focusing on RNs that are preparing to take the nclex exam. A couple of tips to help improve your score when you do take that nclex exam. Number one is, again, we're a couple of months before hopefully you have to take it. So what I want you to do, what you need to do is to, number one, think positive. And what do I mean by that? Well, if you've taken the PN test before, you know what the setting is like. You're going to go in, you're going to get your fingerprints taken. You have to take your letter saying that you're okay to test, your two forms of ID. And so hopefully you remember the process. You remember that you're going to be in a cubicle kind of setting, no noise. Everything's going to be taken out of your pockets and put into a little locker. So picture all of that. Picture the entire process from beginning to end. Not only that, but picture you passing. The reason I say this is because come test day, most people are nervous. And if you're nervous, if you're afraid, if you're anxious, that will affect how you test. That will affect some questions. And the last thing you want is to get really, really nervous, get really, really anxious, and have that anxiety affect your test taking skills. So the best way to prepare for that is to, anytime that you sit and take questions, mimic, pretend like you're taking the real thing. That way when you go and do the real exam, you're prepared, you're ready, your mind is ready. So that's why I say think positive. Prepare as if though you are taking the NCLEX at that time. Anytime you take any practice questions, whether it's in class or at home, make sure you think as if though you're taking the real thing. Not only that, but practice taking small breaks, because your mind can only go for so long before it begins to shut down and before you're accurate as far as your thinking and your question taking goes. So make sure you take a break, schedule that, practice taking that break. And then the other thing that you need to focus on is if you get a question that you know you got wrong, let it go. Move on. Move on to the next question. Do not let one question affect 5 or 6, 7 questions down the road, because then that's going to affect your overall score. So make sure that if you get one question, okay, that's fine. Take a break, let it go, drop it, move on. Don't stay in a negative state, okay? So that's number one. That's think positive. Along with that is make sure you wear comfortable clothing. Make sure that if you like wearing sweats, wear sweats, because again, you want to be comfortable. You want to be as comfortable as you possibly can for this exam. Now, again, you take care of this. Hopefully, your anxiety goes down and you will make less mistakes. The other thing is when you answer a question, stick with the choice that you made unless you're 100% sure that you know you picked the wrong question. If you're second guessing yourself, I would highly recommend sticking with the first choice answer. The first response is usually the correct response. Okay, so that's why I say make sure you're controlling your anxiety, because again that will affect you maybe changing answers multiple times, and that will affect your score at the end. Now, number three, know your material. There's a ton of books out there, a ton of videos that you can watch. And I think all of them do the exact same thing, and that is teach you the core concepts. As long as you understand the core concepts of diabetes, aneurysms, strokes, heart attacks, so on and so forth, as long as you understand the core concepts, that is what is important. That is what's crucial, because again, the NCLEX is going to ask you about interventions, about clinical manifestations. What would your patient show? If they had diabetes, select all that apply. For example, that will be with clinical manifestations and interventions. What would you do for your patient? Now, it is very, very, very difficult to try and memorize every single thing. I mean, there's just so much information, it's very, very difficult to do. So I do not recommend memorizing. Instead, I recommend you knowing the concepts entirely, or at least the pathophysiology. If you understand the physiology behind diabetes, heart attacks, TIAs, then you'll know what to eliminate on the question. That'll make your select alls very, very easy, because then you'll know that this thing does maybe not apply to a certain pathology or certain physiology. But again, that goes by you knowing your core concepts. The other thing is with knowing your material, make sure you know what to assign to a CNA, what to assign to an RN, to an LPN. Remember, anytime you're teaching, anytime you're interpreting, anytime you're discharging, anytime it's a new patient on the floor, anytime it's something acute, the RN will receive that patient. Anytime you're administering blood or anytime you're starting an IV, only RNs can do that. So please remember that. Do not be fooled on the NCLEX exam. Make sure you know what goes with an RN and what doesn't. LPNs, they will get the stable patients. They will get the patients that are there maybe for a longer period of time. Again, those are routine things that are done on a daily basis. Those things can go to an LPN. NG tubes, Foley catheters, some dressing changes. Those things, again, can be assigned to an LPN. Now, for example, your CNAs will be getting the patients that can be fed, that need to be dressed, that need to be transported from maybe one department to another. Okay, that will be the roles or the jobs of the CNAs. So make sure that you understand the difference. The other thing that I've seen a lot on the NCLEX exam is, for example, isolation precautions, putting on gowns, gloves. You want to make sure that you know what steps to take. What are you putting on first? What are you taking off first before you exit the room, before entering into the room? Make sure you know those. Again, these are just small, very, very small questions that you can get easy points on. And so again, the way that the NCLEX is designed, you might get a select all. If you get it right, you might get one more and get another select all. If you get a couple correct, then it's going to go ahead and move you to a different portion or a different section. At least that's my understanding of it. And if you get multiple wrong, then it's going to keep asking you and seeing whether you really know your material or not. So these are just, again, very, very easy points that you can accumulate. Make sure you know your isolations, your contact precautions, airborne precautions, that type of thing. What would you wear when you enter these rooms? What would you take off first? Now, once you know your basics, we're moving on to number 4. Once you know your core concepts, your physiology, now you can begin to take multiple questions. You can take all the test questions you like. And a lot of people take test questions first and then go and study. Well, I recommend the opposite, that you understand the core concepts first, and then you go on and look at your questions, because it is at that point that you can realize, okay, well, I don't know this part, or I'm lacking in this section, or it might be something brief that, oh, I can't believe that I read that question wrong. And now you can go ahead and do some polishing on your skills. Okay, but if you take a lot of test questions first, that might confuse you because you don't know what to study. You might be bombarded, you might be overwhelmed, and become a little bit anxious because maybe you feel like you don't know anything at all. And again, that's why I recommend that you not take questions first. Make sure you understand the core concepts. Once you understand the core concepts, feel free to take as many questions as possible to see if you really actually do understand the material. Because right now, if you're going to be taking a lot of test questions, this is a time to go ahead and find out whether you know something or not. This is a time. You don't want to go in and do the NCLEX and then find out that you didn't understand a certain concept. So please make sure you understand the core concepts, and then by all means take all the questions you can, all the questions you want, and then that will let you know if you really, really know the material or not, or if you need to go back and reread something. Number 5. Let's see, I have a lot of things written down here, so let's see, number 5. Like I said, there's a lot of material to be covered, whether it's OB, pre-op, post-op, heart problems, problems with the brain. There's a lot of material. And so it's going to be difficult to know everything. I don't know one person that does know everything. That'd be very, very difficult. So for the things that you absolutely know you are going to forget, memorize those. When you take your NCLEX, remember that you get a small piece of paper, memorize it, and as soon as you get to taking a test, write it all down. That way you don't forget it, because maybe that'll pop up on the NCLEX. So as soon as you sit down, the very, very first thing that you need to do is write that information down. Like I said, you're going to be taking a test. You will most likely begin to feel a little bit of anxiety, feel a little bit scared, and you may forget that information. So if you write it down as soon as you sit down, when you take that test, boom. Hopefully you get a question asked about it and the information is right there for you. So please, as soon as you sit down, make sure you write that information that you know you're going to forget. Okay. Number 7. Me for example, I live about 2.5 hours from the closest testing facility. I know a lot of my friends, a lot of my classmates, they would go the night before. They would get a hotel and stay the night before. If you're going to do that, if you're one of those people that needs your 8 hours of sleep, then I highly recommend you do that. But the other thing that you also need to do is make sure you check out the room. Are you comfortable there? Is it a good place? Are you going to be sure to get a good night's sleep? The reason I say that is a friend of mine went, he booked a room, went the night before. He got there around midnight and the air conditioning wasn't working. He couldn't sleep. So that was pretty much a wasted night. He went, couldn't sleep, couldn't rest. Well, you want to make sure that the room, that the hotel is actually going to be a place that you're going to find comforting, that you're going to be able to sleep. Because if not, again, if you're one of those people that needs your 8 hours of sleep, well, make sure you get your rest. So check out the hotel, check out the room, make sure it's something that you're going to be comfortable sleeping in. The other thing is, number 8, before you take your test, make sure you eat a light meal, okay? Fruits, veggies, anything that's grilled. Make sure you stay away from fatty foods, no high carbs. The reason I say it is because if you eat a lot of carbs, a lot of pancakes, a lot of donuts, a lot of greasy cheeseburger, fries, all that stuff, what's going to happen? You're going to go and take the test, and maybe an hour or so later, you're going to carb crash. You're going to get really, really drowsy. And that is the last thing that you want when you're taking your exam. You don't want to be drowsy. You want to be 100% clear, focused. Okay, so don't eat foods that are going to cause you to, quote unquote, carb crash. Okay, so eat a light meal, something that's good for you. Again, fruits, veggies, some cereal, some orange juice. Again, a light meal. That way you don't carb crash during the exam. If you don't drink caffeine, then don't drink caffeine right before the exam, because what's going to happen is you're going to get really, really anxious. The caffeine is going to kind of speed your heart rate up, and then again, you're not going to be clear, you're not going to be focused when you take the exam. So these are just a couple of things that can go a long way. Now make sure that when you are taking your test, again, you take a break. If you feel like it's not going your way, get out, take a break. And again, if you've practiced taking a break before, like I said in tip number 1, then you're used to taking a break, go out, walk around a little bit, get some air, get some water, and refocus, come back with a clear head. Okay, don't let one question throw the entire exam off. Brush it off, move on. Now, in the off chance that you feel like it's just not going your way, it's not your day, it's okay. Don't freak out. What you need to do is you need to remember as much as you can. When you get done taking the exam, go back, write what you remember down. Now, why? Okay, you miss those questions for a very, very specific reason. So write the stuff that you do not know, that you do not remember, so that you can go ahead and go over that material so that you're ready for the next time you take the exam. Okay, so again, at all times, remain focused. It'll help you out. Again, like if it's not going your way, that's fine. You can always retake it. Don't freak out. It's not the end of the world. Just remember what you missed. That way you can focus on that material for next time. Okay, well, thanks, guys. Those are my quick tips on improving your NCLEX exam. If there's something that I missed, or maybe you have a tip of your own, please write it down below.